And welcome back to the Michael Garfield World According to Garf show. It is a wonderful, wonderful day and wonderful information. Every week we always sit down at this time with a doctor from Altus, A-L-T-U-S, with the Altus Health Update. This is a good topic. I like this one because this has to do with sleep. Now, I know I never get enough sleep. Maybe I have a disorder, so I'm going to find out some information here and probably go to Dr. Badar, Tehmina Badar. She is with Altus. She is going to talk about some sleep medicine. Dr. Badar, appreciate you taking a few minutes today. How are you?
I'm great. Thank you for having me.
You are a board certified, I guess, in sleep medicine. Tell us about sleep disorders and, why do so many Americans have trouble sleeping these days, including myself?
Well, I think, first of all, we don't put enough importance on the value of sleep. And we are overly stimulated. We've got too many things going on. We've got smartphones, TV, iPads, all of those things staring at us, and then we try to sleep right after that, and we don't have enough melatonin, which is the key hormone that helps us fall asleep. And that's because when we are exposed to light, the light is trying to tell our body it's time to be awake, and therefore the body doesn't produce that sleep hormone. So the main aspect that we need to realize is we need to shut down all our electronics before going to sleep.
Now, that's tough for me to do because I am the high-tech text, and I'm the guy telling you to go make sure you're logging on and keeping in touch. And I guess you're saying is too many gigabytes, not enough melatonin.
There you go.
Sleep-disordered breathing. What are some of the common signs and symptoms of the sleep-disordered breathing I've heard about?
First, let me tell you a little bit about what that means. Sleep-disordered breathing is when we just don't breathe well when we're asleep. And there are several different kinds. There's obstructive sleep apnea syndrome, which is the most common one that we see. There's complex sleep apnea, and there's central sleep apnea. Now, obstructive sleep apnea, think of it as your airway being obstructive. So if, let's say, someone is standing over you, choking you every, let's say, 20, 30 seconds, and then releasing. So it's your own body betraying itself by the airway collapsing on itself, and therefore no oxygen's getting in, no carbon dioxide's getting out. Your brain says, hey, there's something bad going on here, and I need to change this. And what happens when that brain signal happens or that arousal happens is that our sleep cycle is disrupted. So we could sleep 10 hours at a time, but we would still wake up feeling tired and unrefreshed.
Is this common among people? How do you know if you have it?
It's extremely common, and probably 15 to 20 million people in this country alone have obstructive sleep apnea syndrome. Some of the key signs and symptoms are snoring, daytime sleepiness, falling asleep at the wheel, witnessed apneic episodes. And an apneic episode is where you're actually seeing someone not breathing. So let's say they're snoring, and then, oh my gosh, there is no sound. Well, that's when they stopped snoring and they had an obstructive event.
Dr. Tehmina Badar, she's joining me here. She is with Altus Health Update. We do this every week. Great topic over here. We're talking about sleep disorders and sleep medicine. Some of the options for people diagnosed with sleep disorder, like sleep apnea. I'm aware of the term sleep apnea. A few of my buddies have it every time we travel. Maybe we share a room, and they're just hooked up to these big machines. Right. How can people find out if they actually suffer from sleep apnea?
Well, first off, talk to your doctor. Tell them about your symptoms. Tell them that you're concerned about the snoring and the daytime sleepiness, because sleep apnea is not just a gee whiz, I'm tired all the time problem, or I'm snoring and my bed partner is going to shoo me to another room. It's associated with significant health sequelae such as high blood pressure, even heart attack, heart failure, stroke, diabetes, problems with mood, problems with concentration. So you talk to your doctor about it, then they will likely order a sleep study. And that's where you go and spend the night at a sleep lab. Hopefully it's an accredited sleep lab like Serenity. And you spend the night there. You're hooked up to a bunch of wires, so make sure you're good and sleepy that day. Try to avoid caffeinated beverages. And you just get to sleep, and we monitor whether you are having these breathing events.
Dr. Tehmina Badar is joining us here talking about sleep apnea and a number of other things. If you are diagnosed with that sleep apnea, I know there's several things that can help. I know these machines, these breathing machines, sleep apnea machines, they're getting smaller. They're getting a much more high tech. Is that the only thing to help it? Is there any actual medication?
Really, there's no true medication that alleviates the obstruction. So these machines that you're talking about are positive airway pressure devices, and there are several devices out there, and as you alluded to, they're getting newer, they're getting fancier, they're getting more high-tech, and therefore more easy to tolerate, although they do take some getting used to, that's for sure. Other options are oral mandibular advancement devices or tongue devices that pull the jaw out forward or the tongue away from the back of the throat only while you're asleep, so it's not like you wear them during the day, and they help to keep the airway open as well. Other options are surgical options, and there's a number of those type of options, and you should talk to an ear, nose, throat doctor about those.
All this to get a good night's sleep, huh?
Oh, very important, very important.
It really. Do you recommend an X number of hours to sleep, or percentage of how much you are awake? I mean, what do you tell your clients or just general consumers?
Really, it depends on the person, but on average, 7 to 8 hours of sleep is really important for daytime functioning.
So about the 4 or 5 that I'm getting, it's not the greatest thing for me. I need to try to sleep a little bit longer. I just shut the kids up and don't wake me up in the morning.
There you go.
Dr. Badar joining us here for another minute or two. Obviously, this is the Altus Health Update. There's something called the Altus Foundation. I understand you're on the board of directors. What's the mission of the Altus Foundation?
Well, their mission is to develop resources for patients in need of healthcare services. And what that means is we're trying to give back to our communities, and it involves, of course, the network of physicians that are part of Altus, and we're trying to give back.
Giving back is good. I understand the foundation raised more than $100,000 at its gala last December for patients facing, financial challenges and, accessing care. Are there any other initiatives that Altus physicians are involved in to provide better access to care?
Right. And so, since we are trying to provide health care, what we have asked our physician partners to do is donate their services. And so far, we've had a good response. The doctors that I've talked to are very excited about this. And, for instance, if I say, I'm going to donate 2 or 3 patients a month, and if we have 1,000 doctors doing that around the greater Houston area, Beaumont, Baytown, and other areas that Altus is a part of, then we're really going to have a significant impact on our community's health.
Dr. Badar, you're getting very sleepy. That's the key. Hey, listen, if anybody wants more information about your practice, how about a website or a phone number where they can reach you?
Right. Our office phone number is 713-988-0850. That's our main office number, and our website is pccs-md.com.
You also have 2 locations. Where are they located?
Our main location is off of 59 and Beechnut next to Memorial Hermann Southwest, and our second location is in Sugar Land off of Highway 6. Fantastic.
This is Dr. Tehmina Badar. She is obviously part of the Altus organization, and the Altus Health Update every Wednesday right here on my show right about 12:50. I do thank you for your time. I can't wait to sign off here about 2 o'clock. I'm going to go get me some sleep with all your recommendations, so I appreciate it.
All right. Take care.
All right. We're going to be back in a few minutes on the other side of the hour. 713-212-5950. This is Michael Garfield and the World According to Garfield.